Good afternoon, everybody. It's so great to be here with all of you at the AHP International Conference. My name is Erin Stitzel, and I'm a principal consultant with Accordant Health, where I help lead grateful patient strategies and physician engagement for our firm. Today's session is called 2020 Trends in Grateful Patient Philanthropy That Can't Be Ignored. Now I'm going to go ahead and let my co-presenters introduce themselves.
Hi, everyone. My name is Rea Ganesh. I'm the Vice President of Philanthropy and Strategy at North York General Foundation in Toronto, Canada. I've been in the healthcare philanthropy for close to 20 years. I'm excited today to be presenting. It's a Grateful Patient program that's relatively new to North York General, and sharing my experiences on some of these trends that definitely shouldn't be ignored.
Hello, everyone. I think many of you might know me. I'm Bill Littlejohn, and I have the honor of serving as the CEO and Senior Vice President of the Sharp Healthcare Foundation. And I'm actually here in my office today, which I'm glad to be in San Diego, that we're able to work in the office in this crazy time. And I've been associated with Sharp for like 22 years now. I'm going to put a plug in for tenure during our presentation today. And 4 years in council and 18 years as the Senior Officer for Philanthropy, which it's been a great experience for me. Been very active in AHP. I served as chair of the board and done a lot of presentations, and I'm really look forward to this because I think sharing with colleagues is the best part of professional development in AHP and in healthcare philanthropy. So looking forward to it.
Okay, again, so thanks, Rea and Bill. You know, like Bill and Rea have said, today we're going to be talking about grateful patient philanthropy. And we talk about trends, especially when it comes to grateful patients, because organizations are truly across the board when it comes to how we approach this work. So today we're going to talk about things that are working, and hopefully you'll leave today with some tips to adapt or tweak your programs to ultimately become more successful. And truly, there's no two better people to help me share all of this with you today than Rea and Bill. So Bill Littlejohn, you need no introduction. Bill, you and Sharp have been helping all of us for over a decade with grateful patient work by sharing best practices and tips and templates and resources. I can remember when I first embarked upon creating my first grateful patient program in Columbus, Ohio in 2008. I was on the phone with somebody from Sharp almost every month for a year, gaining insights on how to best create our program. So Bill, I can't tell you what an honor it is today to be presenting with you. I started working with Rea last fall in Toronto, Canada at North York General. North York, it's in Northeast Toronto. It's the #2 hospital in Canada. And let me just tell you, Rea, like Bill, is just the epitome of an incredible philanthropy leader. And North York Foundation, like Sharp, just does everything right. So the interesting thing about doing grateful patient philanthropy in Canada, many of you probably know that the privacy laws are so much stricter than here in the US. There is no screening of patient data. There are no compiling of lists to show to our physician partners. Yet here in the US, we have access to all that data. But ultimately, at the end of the day, when it comes to engaging our clinicians in philanthropy, it's all about building trusting relationships. And so we've done just that, and Rea is going to share with you how she's done that. So both Rea and Bill are going to go through some specific trends that we're seeing. Then I'm going to follow up with the results from a national survey that Accordant does to help provide data to back up our theories. I launched this annual survey last year to gain information and best practices around grateful patients to truly share it with organizations so we can all work to become more strategic and efficient when it comes to our grateful patient and clinician engagement strategies. So I'm only going to touch upon a few points today, but a full report of the survey has been uploaded to your downloadable resources. So I encourage you to download that. So on that note, I'm now going to turn it over to Bill, who's going to kick us off.
Thank you, Erin, for that, and thank you for teeing it up in the introduction. And so here we are sort of toward the end of 2020, and I think we all agree we can't get over it fast enough. I've been in this business for 35 years, and almost 25 of it strictly in healthcare hospitals, and it's like nothing we've ever seen. So it really has tested and tried us in terms of thinking about best practices and what we do and adapting to a new environment. And I think that goes back to the aspect of what I made that plug about tenure and being around a while. That certainly has helped me. And you mentioned that you discussed it with us back in 2008, Erin. Well, that's 12 years ago, and I was around back then. And so I think one of the important things when you think about adapting grateful patient strategies is about the overall strategy and the aspect of building relationships with those that we serve. And I've always sort of thought about that the patient and the constituent has the relationship with the institution. And really the core of our role is to facilitate that grateful dynamic, that gratitude, that loyalty, whatever, however we define it, our jobs professionally. And we have this unique opportunity because the experiences take place within the institution to facilitate this dynamic. And so there's aspects of everything from visiting patients to doing caregiver recognition to email to direct mail. All these mechanisms we use, the fundraising tactics, are based on our ability to effectively connect and engage with patients who we hope are grateful and then also hope are philanthropically inclined. So I think it's really important to always have that perspective that it's really not even a grateful patient program. It's an engagement opportunity for those that the institution serves. So as we think about, sort of adapting now, of course, with COVID-19, that was just our world turned upside down. And we have been trained and geared toward doing in-person fundraising forever. I mean, it's the people to people interacting. And all of a sudden, we all had to work from home, and we couldn't visit patients in the hospital, and we had this sort of complete division of what we would normally do. But it also meant that we still had strategies we could employ and sort of new things to think about, because ultimately the job is to connect and connect effectively in how you do that. So I go back to the aspect of tenure and strategy that we've had patient visitation programs, are a friend of the foundation, and we've been doing all that kind of work for many years. That meant we had in-serviced a lot of the nurses and managers and clinicians. So they became not just allies, but really good colleagues of ours. And we tapped into that with COVID, where we couldn't visit patients, but we still had friends of the foundation in the hospital. So we were able to sort of pivot, the word everyone's been using, pivot that dynamic to where we could contact a nurse manager or a leader, and on our behalf, they might interact with the patient, that they would be our eyes and ears and our friends in the hospital. That came from in-service, not just sort of having a checklist that this is what they do. That relationship we had established. So that, we've been doing that a long time. We didn't know we'd need it so quickly when we had COVID come along. And the same thing is true with our caregiver recognition program. Most people have that today. If you don't, I encourage that. And Erin has lots of great information on how you can do that. And the aspect of honoring caregivers, that is an incredibly great way to connect the caregiver dynamic. And our Guardian Angel program, we've now done 50, 60,000 of these, and many, many, many presentations in person, but we had to completely pivot that. But one of the things we had implemented a couple years ago was automatic email notification to the caregiver that they've received a Guardian Angel, even though they haven't received their card or a pin or any other recognition. So the fact that we were able to do this in real time made a big difference in COVID in terms of, we weren't able to make that in-person recognition. We were still processing gifts and receiving Guardian Angel recognitions, but we were able to automatically notify both the recipient and their manager and create that dynamic. And then within a month or so, we actually set up some Zoom Guardian Angel recognitions where we invited recipients at a various entity to come on to a Zoom session for 20, 15, 20, 30 minutes and just say thanks and just have a kind of interactive roundtable and to appreciate them. So, that pivoting in the aspect of moving to a virtual format. So what the point I wanted to make here is that aspect of that And I thought about this is that, we had to go remote in March like everybody else did, move to home. But I said, we have to be able to continue to operate the philanthropic dynamic or the engagement in a virtual format versus the ways we've done it. So it's not like say we can stop doing this or we can't do this anymore. We can only do X. I said, we're going to do almost everything we know has been successful, but we're going to transition it to the platforms we know can be successful for us. So that's the same thing as that we implemented a very extensive marketing and advertising campaign during our COVID response, which included hundreds of thousands of emails that we coordinated with marketing to send to patients. And Erin moved the slide forward. Thank you for that. And that we did a lot of graphics and marketing and messaging to everyone in Sharp. At the end of the day, that this was not about just a philanthropic response to COVID-19, or we're just raising money for PPE and for these types of things. This was a Sharp initiative to tell the community of our leadership in philanthropy and tell the constituents who turn to us for help and care that we're all in it together. We value your relationship and you can partner with us to help us in our time of need. And the response has been incredible. So again, the aspect is that, and we did it all electronically. So we used social media, and we used email, we updated our website, we moved things to the home page. And I want to put a real pitch in here that, and people have kind of complained about this, of the relationship or the challenge with marketing. But if you think about it, the opportunity that presents is significant, to where you collaborate, and it's not just about fundraising, but about messaging to the community. And the theme of we're all in this together and that we are a great community asset. We believe we've strengthened our overall case for support by communicating effectively that this is what we do. We take care of the community. So we really have made a lot of adaptation to multi-channel and virtual platforms. So it's not just like, let's just do email. It was very strategic and thoughtful to do email, web, content marketing, and then do social media with Sharp social media platform. All of these allowed us to continue to connect with who? Our constituents, our patients. We continue to do direct response. And so all of that, we've adapted that. And I said, I remarked this to the system board, that in 5 months or so, we raised $6 million for COVID response, including we had a lot of generous gifts from our employees, without one single in-person meeting. That's just, we would never even contemplated that. But what it was we implemented strategies of connecting. We've connected with hundreds of people now through Zoom, people we hadn't connected with in a long time. We've built a much better email connectivity. We've increased our communication significantly. So ultimately, it goes back to then, back to this great title that Erin put together, this adapting strategies. It was the aspect of connecting through care, connecting through relationships. It was built on a lot of work for many years, but we adapted it in a matter of days to new platforms, and the response has been overwhelming. The number of new donors we've got more new donors through COVID than we ever had through any single acquisition program. So it's just sort of blown us away, but it also proves that it goes to the aspect of strategy, that ultimately our jobs are to facilitate the connection. So we have to be proactive and thinking ahead and creative in how we do that in a new environment. And that's going to continue on in FY21 for us. We're just now finishing our fiscal year. So we've really, and you can see on this slide that we've messaged a lot. We've doubled and tripled down our communication, and that has been incredibly valuable. So, I think, and again, after this, I know we have opportunity to share information after the conference. I think there'll be a lot of posting of information. I think we all need to do that. There are great stories from everyone out there, and you're going to hear from Rea about that in just a moment. So the next thing, that's just sort of the, kind of the thumb sketch of what we've done at adaptation, and again, encourage you to make sure you think through how best to continue to do what you do, but also in a new environment. So the next slide is we've been now working on, some people are be able to do this, and we do a lot of research and And we do a lot of work with the physicians, and we're very fortunate that part of our Grateful strategy is really good at physician engagement, clinician engagement, that in-service that we've done, the recognition. We actually have established and worked together with our EHR system, the Cerner system, and our IT folks over the last year, and our CNOs, our chief nursing officers, that we have now put together an order set, a philanthropy order in the patient record that clinicians, nurses, and doctors can use to actually make a referral to the foundation directly in the electronic health record. That is, they can go right into Cerner and place an order. It's just like any other order they would place for medications or anything else. And it's nothing more than basically communicating to the foundation that we have a patient that we think would be a good for referral. They really don't have to make too much of the way of comments of it. It's just the aspect of that can happen. And rather than them emailing us sort of outside of work, this now is a direct order that they can place at any time. And what's really important, though, is we have to train and orient the clinicians to be able to use it effectively. So what we've done is we put together a training video, and actually we now have a very detailed schedule of actually sharing this, and that you can see this, we're going to show the video and you're going to be able to see it, that we actually have all the screens in Cerner for the physicians to understand how to place the order. We have a great story. You'll see this in the video. I hope it's only about 3.5 minutes. Watch that. And that's now we're going to post that on our intranet site, and we're also going to be able to set up meetings with medical executive committees and section meetings and individual huddles and things like that. So it's a very detailed schedule during all of FY21 that we hope we will have educated and taught literally thousands of clinicians to be able to easily refer to us. But also just going to say as I finish is that this is going to work, and I believe it's going to work, not just because we got a video, we have an order set, because the work we've done for the last 15 years of cultivating physician relationships, caregiver recognition, patients, they trust the foundation to facilitate those relationships. And they trust us through our in-service. So they are partners, they are allies with us. This is a really important strategy, and that takes time to do that. So you can have this is great, and we'd happy to share more of this and that we took a year to work this out, but we know it's going to be successful because we have built strategy and relationships, and we have done a good job of not now putting this together, but also a program in which to train and orient and answer questions and make it work. This is not about getting it to work in FY21 and getting 1,000 referrals. This is for the next decade of relationships that we will bring to bear. So hope you enjoy that video, and we'll make it available as well as the supplementary materials to that.
My name is Charles Overbeck. My friends call me Chuck. I wanted to do something for other people, to give a gift so that we could improve healthcare and outcomes of people who were actually going through chemotherapy.
Philanthropy touches virtually every aspect of Sharp Healthcare. Philanthropy helps provide new facilities, new technology, helps provide for research activities, program support, nursing scholarships, you name it. There really isn't a part of the organization today that philanthropy doesn't touch.
As a clinician, I'm often faced by patients that are happy about their care and want to express gratitude. And that's when it's a good opportunity for me to tell them about the mission of Sharp and how much of what we do is based on the contribution of patients that have gone before, large or small.
Nobody expects doctors or nurses to ask for a donation, but there are some cues you can listen for. When you hear, "Thank you so much for your care, what can I do to show you my appreciation?" You can say back to them, "Well, thank you, there is something you can do. As a nonprofit organization, we have a foundation. How about if I put you in touch with them and they can explain to you some wonderful opportunities for you to express your appreciation in a way that will help us continue to provide great care."
I'm expressing how much you mean to me and what you did for me matters. And to me, that isn't just because you just did a job.
Foundation money and the generous contributions made by patients and others go into the treatment of patients on a daily basis here. These generous contributions are the backbone of all these programs, and without them, we couldn't do what we do every day.
This is the best money we've ever spent. And it's funny, we gave, but we received more in return.
Refer grateful patients to Sharp Healthcare Foundation with 3 easy steps in Cerner. A new order titled Referral to Hospital Foundation is now available at all Sharp Healthcare facilities. This order can be found by searching Referral to Hospital Foundation or Grateful Patient. We encourage staff to place this order when they encounter a grateful patient expressing interest in giving back. The order will also be available in the following power plans. Within these power plans, the order is located under the Consults Referrals category. When the order is selected, the reason for consult will auto-populate with the statement for Grateful Patient Notification. No additional information is needed to order. If staff would like to provide additional information, they can do so directly with the Foundation when they call to follow up once the order is received. When nurses are entering this order, they will enter the provider's name and select Department Process as the communication type. This order will not need to be co-signed by a physician. Here are the 3 steps. Step 1. Select Referral to Hospital Foundation order. Step 2. Select Initiate Now. And lastly, Step 3. Sign the order.
So again, I hope you enjoyed the video, and we'll make it available to folks. Actually, this is not even the final. You're seeing a preview. Actually, the final version will have some narration with it at the back end in terms of the order set and the instructions of how to place the order. But you, again, included a patient, a physician, and the technical details made it, keep it brief and focused, and the importance of that. So we're excited about seeing this, and we think it'll be a great aspect of our and another strategy for us going forward. So, crazy year, but I want to commend our staff and team for adapting. And I think it's important for all of us to share those adaptations like we're doing today and elsewhere, because I think we all have great opportunities in sort of the next normal to continue to be successful. Thanks, Erin.
Thanks, Bill. So I will continue on trend number 3, aligning your grateful patient strategy around fundraising priorities. Especially when starting out, it's important to stay focused on recruiting key clinician partners for your grateful patient strategy versus trying to get everybody. And I'm going to share my experience, because when we were starting out, we had reached out to all of the chiefs in the hospital to get their buy-in, but also to participate as our first cohort in our grateful patient training. And we thought, who best but to approach our chiefs to be our first physicians. And so when we had our first call with Erin, and kind of patting myself on the back to say, oh, don't worry, we've got this covered. We've already got our first cohort. And Erin and her team advising us that perhaps that wasn't the right direction to go, and for a number of reasons. One, all of the service lines didn't align with our fundraising priorities. So, under their advisement, they were saying, like, you can get all of the chiefs participating, but they all have different fundraising priorities that don't align with what the needs are of the hospital. So you'll be scrambling to work with these chiefs that are trying to fundraise for different areas that I didn't need to be focused on. So that was really, really good advice. And then the second piece that was really important was we had limited staff resources. So at that time, it was pretty much myself and maybe another fundraiser that was starting the Grateful Patient Program. And, Erin came and said it would be really difficult to try to manage all these chiefs with their different priorities while I'm still trying to align with our fundraising priorities. And I also have a lot of other priorities that I have to do in terms of trying to get other major gift prospects. So trying to have all of these competing priorities would be really challenging to do. So we took that all under advisement, and what we did instead is what we reviewed our fundraising priorities year over year. And we looked at to say, what was the trend? And surgical equipment was always a need. Every single year, we're always needing to buy new surgical equipment. And so we were very strategic when we started looking at the physicians in our first cohort, that half of those physicians would be our surgeons. And what we also then looked at is we reviewed our Say Thanks program. So that's our program that we honor our healthcare providers. And we looked at our top 10 physicians that have been honored over the last 2 years, and we handpicked the ones that fit with our fundraising priorities. So we're very, very strategic in building out our first cohort, that they were aligned with our fundraising priorities. And that was really, really important and a good learning lesson for us. Trend number 4, gratitude comes first when it comes to clinical engagement. And definitely when we started the training, we wanted to make sure that we were speaking the same language as the physicians. And so we really wanted to focus on the science, primarily the science of gratitude. So we had conducted, oh gosh, it was probably like 15 sessions over a 3-day period, you know, aligning our schedules with the physician schedules so that we could hit as many physicians during that time period. And one of the key things that was so interesting to me was we had our little laptop in a boardroom, and we were training like 2 to 3 physicians in each session. And all of them leaned forward when we presented these 2 slides. And one of the slides being, what would most likely motivate you to make a charitable gift? And they were all fixated with that 34% desire to express gratitude for care. And then the next slide, where we asked the question on, during your health experience to a grateful patient, to whom are you most grateful? And, you know, the huge percentage being with the physicians and nurses. So these 2 slides, and it was fascinating because each physician all gravitated to these slides, and it really reinforced their comfort levels with us training them on the science, but also coupled with these statistics, that they were more comfortable engaging on this level with patients. And the other piece of the training that was really important is we turned it back on them, and we said, when you have a patient expressing gratitude, like, how do you react? And again, all of them reacted the same way. Like, they shrugged it off. They said this was part of their job. And we were able to turn around when they do spot that gratitude, and how to then take that and introduce the foundation. And similar to the video that we just saw, we provided them with some like really quick sound bites. Like, if you'd like to express your gratitude, I'd be happy to introduce you to someone at the foundation. We had a lot of, and Erin can attest to this, like reluctant physicians. You know, this was very, very new to the hospital. Uncomfortable. They thought that we were wanting them to ask for money. So we did incorporate the foundation piece on that. We're always looking for grateful patient stories. We have direct mail pieces, we have social, we're always posting these stories that resonate with the community. And so we gave them that opportunity as they're, you know, spotting this gratitude, that they're comfortable to say, we can introduce you to someone at the foundation. And if you're interested in sharing your story, they would love to hear from you. And this was resounding approval from all of our physicians. Like, this took them to another level of like being very reluctant to saying, like, almost like their shoulders just like went down, because it was like a relief to them that, okay, we're not asking for money. This is something that I can do. And then what we did is we created these cards, and that's on the slide right now, where it's got a picture of the physician with a nice quote, and then it's got my picture and my contact information. And this was just, they wanted some sort of like collateral material that they could hand over to the grateful patient. And then at least the patient also knows who's calling them from the foundation. You've got a face, there's just that better connection. So again, demonstrating the importance of gratitude to our clinician partners by showing them the science first, giving them those stats that they love, providing them with those sound bites, and then also giving them the tools made it really, really easy. You know, I shared with Erin, one of our most reluctant doctors that was just like a naysayer throughout the entire training. And it's been kind of quiet during COVID because we did a lot of this training in February and then COVID hit and, you know, kind of winded down. But this doctor, you know, emailed and was like, I've got a grateful patient program. And then I bumped into him 2 weeks ago and he was like, more to come. Like he was just so excited. And it was just reinforcing that like the training that we did work. And even our biggest naysayer was the one that was like, more to come on this, because now he's getting into the comfort. So I'd have to say all those key pieces are so important when you're engaging the clinicians. For trend number 5, the importance of elevating a culture of gratitude while advancing a grateful patient engagement strategy. I would say this was so important. And again, this is very, very new to North York, but we know the importance that you cannot build this grateful patient program in silos. Like it has to be part of a larger strategy with the hospital in terms of creating that culture of gratitude throughout the hospital. And especially during this pandemic, it was really, really important to us as we were all working remotely. You know, the health and well-being of our hospital staff, their spirits were down, ways that like the foundation that we can take point to building out that culture of gratitude throughout the entire hospital. So what we did is we created This is the Frontline series, and it spotlighted a lot of our healthcare staff from all service lines, showcasing their contributions and their stories. We created blogs, we sent out emails, we did a huge social. And what ended up happening was received a lot of engagement, both from the hospital, but also from the community. So it was really a really good series. And again, it just didn't spotlight Frontline, it spotlighted everybody, because one of the key things that we were hearing was that Frontline, but there is also all of the other staff that are working really, really hard on the back end. So we tried to share different areas throughout the hospital and share their stories. The other key piece, and Bill kind of alluded to this as well in his success in terms of donations during this, you know, the past 6 months, was we made a conscious effort for any donors that were making a donation to our COVID efforts that we would either personally email or call each and every one of those donors. If it was a $25 donation to a $1,000 donation, everybody was receiving a phone call. And what happened with that was a lot of the donors either were sharing their grateful patient stories with us on why North York was so important, but they also wanted to relay messages back to the staff. So we had like all of these messages now, and we didn't know how, because we were working remotely, how we would get these messages out to the staff. So we created a virtual gratitude wall that's on our website that showcases all of the messages that we received. We also took these messages and we created posters that are around the hospital so that staff can read them as they're walking through the halls. Our CEO of the hospital also showcased this in his hospital-wide communications, featuring the virtual gratitude wall. And still up to now, every Thursday, we do social posts for Thankful Thursdays, where we post these messages. And again, it's been a huge piece. Like I said, we just started this out, but the pandemic hit, but we still kept moving on. So as Bill was saying, like we didn't stop, we pivoted to different ways that we can still express this gratitude throughout the hospital. It's over to you, Erin.
Thank you so much, Bill and Rea. Gosh, and you know that this, just hearing your successes, it's incredible and it's really exciting. So I'm going to touch a little bit upon, but now we'll officially kind of transition to this grateful patient survey that's been done. And I'm just, again, going to touch on a couple of points because it really backs up many things that Rea and Bill have said. quickly, the survey, we had 60 organizations participate, mainly from community hospitals within larger healthcare systems. And of the participating organizations, 77% have a formalized grateful patient strategy. So I'm going to first talk about data because, especially in the US, when we think about grateful patients, when we've thought about this for the last decade, it's always like, okay, let's gather our patient data. And as you heard with Rea, I mean, they don't have access to data. And I remember, when we embarked upon this journey with North York, it was actually really fun. We're going to go back to the basics here and build these relationships. And as you saw, everything that Rea and North York have done, and as Bill mentioned too, ultimately at the end of the day, it's about relationship. But that being said, here in the US, we have access to so much patient data. And, I know you're all at home, but raise your hand if you're sitting on thousands of patient records that you probably don't use. And so, I'm going to share that the trend with patient data is that we've got to be more strategic when it comes to using all of this data. Several of my clients only pull data within the service lines that they're focused on. If we want to wrap our hands around this further, we can reduce the frequency that we're pulling data. The days where we have to pull it every day, we don't have to. As you'll see, only 40% of the organizations that we surveyed are pulling data every day. And then two, we've got to look at the tools we've got available today, because the fact of the matter is there's so many different tools out there available that provide additional data points that allow us to dig deeper into this data with the hundreds of thousands of patients walking in our doors. 51% of our surveyed organizations are utilizing additional tools beyond wealth screening, additional analytics tools like artificial intelligence and modeling. I will tell you that any of my clients that have started using these types of tools, things like Blackbaud Target Analytics, Gravity, they've been very, very happy using these types of tools. So let's talk about development and rounding programs quickly. I know, Bill, you had mentioned, I mean, you've really had to shuffle things with yours. I mean, again, we're at home. Many of us are still at home. And even if we're not at home, we're not rounding through the hospitals. I'll tell you, even before COVID hit, development rounding programs were on the decline. Last year's survey, only 40% of organizations indicating having one. This year, that number's down to 24%. And why is this? Well, there's a couple of reasons. First, these programs encompass a ton of staffing time and resources to go and what I call cold call rounding on patients. And quite frankly, the return just isn't there many times. Second of all, like Bill so adequately and wonderfully stated, they've been working on building relationships with internal constituency for years. And that's really paid off there, because those folks, people like our nurse leaders, our patient experience team members, social workers, case workers, even our CEOs, our administrative leaders, they're all rounding on our patients every day. And so we've got the opportunity to do what Bill has done and work with those folks and build relationships with them and train them. We can help provide some scripting and tools so that they can do the heavy lift for us, especially now with COVID, we can't be in those rooms. So when we engage our clinician partners in this work, our nurse leaders, our social workers, our doctors, we've got to have tools available to help make that connection easier for them to do. This is why I love what Bill shared about their Cerner project. When he told me about this, I was like, I need to learn more about this. How they're helping sharp physicians and clinicians directly refer patients through the electronic medical record. And this is becoming more prevalent. You'll see 18% of our surveyed organizations have the ability to do this with their EMR. Currently, I'm working with 2 different clients to do this at their organizations. At one of them, we're calling it the gratitude consult button in Epic, where similar to Cerner, they're going to order a gratitude consult through Epic to alert their development officers to come visit and call on those patients. You know, again, when we purposely engage our clinicians in this work, we've got to make it easy for them. There's no blanket approach to clinician engagement in philanthropy. Currently, I'm working at a 9-hospital system in Kentucky where we're implementing clinician engagement at all 9 hospitals. And I'll tell you, in the past few months, I've met with 50 or 60 physicians who they each had a different comfort level with the various ways they could refer a patient. Many said they wanted to do it through Epic, the EMR. Many wanted to use the referral cards, like Rea showed you. Many just said, I'll probably just text my gift officer. But, you know, 2, we also have to look with our nurses. They're very prevalently rounding on our patients. Many of our nursing leaders are using apps, rounding apps, iRounds or Rounds Plus, where they're literally able to track the outcome of their conversations within an app. And in those, those apps have the ability where you can literally click a drop-down box and click if they want a consult from the foundation, and that'll go directly to the foundation. So I really want to hone in on the fact here. I often say, take a multifaceted approach to clinician engagement because make it easy for them and give them different ways. You know, and again, ultimately, as Bill and Rea have both said, it's about building those relationships and giving them the tools then to be able to do it. Lastly, I really want to encourage all of you to think about clinician engagement outside of the 4 walls of the hospital. For example, when I was working with North York and those surgeons, it was abundantly clear. So many of them said to me, you know, so many of my patients are grateful, but it's not, they don't really tell me that in the hospital. You know, when they've had their surgery, they're worried, they want to get home. It's when it's that 30-day post-op appointment when they come back and they're literally skipping down the hall, feeling better. That's when the gratitude is shared in those physician offices. So for example, at North York, we actually created posters very similar to what the referral cards looked like with the doctor on it. And I love that example because, you know, the doctors wanted their pictures on those cards and on those posters because they were really proud to be associated with the North York Foundation. But secondly, they said, you know, this would be so helpful because we can really plant the seed. Let's put up these posters in my office. So while they're sitting in my waiting room, they can start thinking about gratitude because ultimately they're going to be telling me that they're grateful, hopefully, when they come back and see me in my office. And so, you know, again, truly, I've only touched on a couple of the data points, and Bill and Rea and I all joked that we could kind of go on at this for many days. But again, you know, please download the survey report, and on all 3 of us are very, we're anxious to answer questions. I am going to turn it over to Bill now, who will make a few concluding comments, and then we'll stop for questions. So thank you so much. Bill?
Thanks, Erin. Thanks, Rea. Great stuff. You know, yeah, we could spend, and we should. We actually should spend, and we should set up a lot more of these types of sessions, and we should do a lot more strategizing and sharing together. I've been a big champion of the long view of philanthropy. We are very big on strategic planning. We operate off a strategic plan. Here we had to adjust to COVID in real time and do fundraising 101, but we were doing it in the context of a long-term plan. And our success came from the fact that we had long-term strategies. So I really want to emphasize that you know, dealing, and I think it goes to the aspect of we don't even think about grateful patients today as much as we think about loyal patients. Our constituents, our patients, they don't come to the hospital very often. They have a lot more outpatient engagements. They're in our insurance company. They interact on wellness things. They're in our network. And so we want to build long, sustained relationships through loyalty and connectivity. And that's why digital strategies are really important, because now you're not going to do as much in person. And if you can flex that, or you can combine that in such a way, you can still have very powerful relationships. But again, it goes back to being long-term and strategic. Lastly, and there's a slide on the screen here about moves. We're all into moves management. It's a big area of focus, but I want to point out the rigor in moves management. And this relates a lot to what Erin talked about of the data we use, like in wealth screening and patient information. That's really a small slice of the big number of moves, but we really have to be rigorous and be disciplined to analyze that. A chart you see on the slide here is just the moves and activities that we've made at Sharp Healthcare between April and September, the last 5 months or so, 5+ months. A total about 6,000 moves and activities. Now, those are all, again, all virtual, all digital. And I mean, phone calls and emails and everything else. And you can see that the amount in qualification and patient relations and identification is pretty small, but it's a good number. But then we cultivate and we solicit, and that's those two are very much tied together. You have to cultivate before you ask. And then, of course, stewardship takes place all the time. But what'll be interesting, and this produced about $11 million in philanthropy revenues. So we have the ability now to go back and do a really deep dive analysis on this moves data to look at what type they were and how many per donor and time frames between them. And this is the other really important about data, not just grateful patient data, but your moves data that applies to those patients, and taking the long-term view that we think in that data is great information to guide us, not just next month, but for the next decade in terms of building those long-term relationships. So, we started this with a talking about, we all had to adapt almost overnight. We adapted well because we had strategies in place, and this is the next normal. And you're seeing from both myself and Rea and Erin how we're, using different tactics to implement strategy. The strategy is still there, making the connection, having a great relationship, sustaining that relationship over time. I think I'm more proud of my 20 years at Sharp, not how much money we've raised, but the respect that I have and the program has from so many people across the enterprise. And that respect and trust translated in gifts for COVID and will translate to gifts next year for our initiatives and 10 years from now. So, think about all the things that we shared and see what you can apply. And again, I hope there's going to be questions that we can answer, and afterwards that we can stay connected and follow up. I think it's just great to do this, and it was really fun to do it with Rea and Erin, and look forward to connecting with folks and sharing more of all of our successes in the future. So thanks, Erin. Thanks, Rea.
Thank you.
Thank you. Thank you all. Thank you, Bill and Rea. Thank you.